Thank you for your interest in becoming a member of Alliance of Therapy Dogs. Our members participate in a wide variety of activities with their dogs. Many visit medical facilities such as hospitals, rehabs, or nursing homes. Others participate in educational or reading programs at schools or libraries. Airport programs are springing up all over the country and have proven to be very popular. It may be one of these places where you experienced pet therapy in action. Before showing you exactly what's involved in our testing process, we invite you to experience how a visit at an assisted living facility is conducted. Take a look. Our video today will show 4 ATD teams visiting several residents of Savannah Grace, an assisted living facility in Mount Pleasant, South Carolina. While every visit is different, depending on the facility setup, rules, and residents, this is to give examples of a variety of types and sizes of dogs on a typical elder care visit. Every visit begins the instant you step out of your car onto facility property and does not end until you re-enter your car to depart. Rules must be followed for the entire time. Dogs must be on correct equipment and under control when they get out of the car. Many facilities will ask that you sign in as volunteers before proceeding to the area where the visit will take place. Today we have a large dog, a tiny dog, a dog in a stroller, and a dog that enjoys performing tricks for residents. You will see various approaches and positioning to create the best interaction between person and dog. Large dogs should be walked up to the side of a chair so that the person can pet on the back. Approaching from the side affords a large area for petting, keeps the dog from stepping on the person's feet, and keeps the dog's face from being in the person's face. A tiny dog needs to be held in order for a person to reach her for petting. We do not want people to lean over or reach too far. Notice the dog is held so that the person has ample area of the dog's back for petting.
Good girl. Hello. Good morning. See Nina? There we go.
We do allow dogs to visit if they are secured in a stroller specifically made for dogs, and the handler has the leash in hand. A stroller might be used because the dog is an older dog or because the handler has medical issues which make it difficult for him or her to pick up repeatedly for people to reach. Some dogs prefer to do their therapy work from a distance. This dog loves to cheer and entertain people by doing tricks. This is just as beneficial as a dog that loves to be petted and sometimes reaches people who are afraid of or allergic to dogs better than cuddly dogs because they make people smile from a distance. Now that you've seen some examples of how ATD dogs behave on visits, do you think this is something your dog can do? Are you still interested? We hope so. We'll break down the testing process so you can see exactly what's involved in the ATD test and what we look for when we test therapy teams. First, you will be evaluated on your handling skills. This is part 1 of our 4-part test. We'll ask you to perform a series of exercises with your dog so that we can observe the relationship between you and your dog, the relationship between your dog and strangers, and the relationship between your dog and other dogs. Your dog should be looking to you for direction. Although you can't use treats during the handling portion of the test, we encourage you to use your voice and your body to let your dog know how well it is doing. We want you to talk to and praise your dog often. Initial meeting. During the initial meeting, the ATD Tester Observer, TO, will greet you, review your paperwork to make sure it's complete, check to make sure you have an approved collar and leash, and that you're dressed appropriately, including wearing approved footwear. No backless shoes or skimpy clothes allowed. You should always look professional. The TO will also check to see that your dog is under control, polite, clean, and well-groomed. Canine human behavior. We will observe your dog's reaction to new people, what we call the friendly stranger. As always, we want to make sure you are in control. We'll look for any signs of aggression, see if the dog shows interest in people, and if it displays good manners. No barking, pawing, mouthing, jumping, or excessive licking. If any of these do occur, be sure to correct your dog. Praise when it expresses an interest in interacting. And here we have a young dog that is not quite ready for therapy work. He needs a little bit more obedience training and good manners training. He's very excited. But here is a dog that one day will be a wonderful therapy dog because you can see his tail wagging. He's happy. He enjoyed meeting with the tester. And so we will tell them to work a little bit more and come back when he's ready. And here is a little dog that is still a little young and a little shy, not totally comfortable with being petted. And even though the tester is being very gentle, she's backing away, hiding behind Mom. So we're going to encourage the team to work a little bit more and come back when Missy Hope is a little bit more comfortable being petted by a stranger. Physical handling of the dog. The TO will go over your dog by stroking the head, body, and tail, if there is a tail, with both hands. The TO will touch the paws, scratch, and pet the throat, and hold your dog's ears. Be sure your dog is prepared to be touched all over. If your dog objects to being touched anywhere with a snap or growl, it is not ready to be tested. If you have a small dog, this exercise takes place while you are holding your dog in your arms, in addition to while it is standing beside you on a leash. Up to a seated person. You will walk your dog up to a seated person. The person may be in a wheelchair or sitting on a bench or chair. Allow the person to talk to and pet your dog. Small dogs which cannot be easily reached from a chair will need to be lifted or propped up on your knee for petting. Do not allow your dog to jump on or paw people, mouth, lick excessively, or bark. Control with loose leash. Your dog must be able to walk by your side on a loose leash. A loose leash means that there is a loop or a J. The TO will give you directions while you are walking with your dog. You'll be asked to go forward, turn to the right, turn to the left, and turn around. There are changes of pace, normal, fast, and slow. Also, while you are moving, a person will rush past you from behind, toward you from the sides, and toward you from the front. Use your voice or pat your side to get your dog's attention if distracted. There is also a halt during this exercise. When you stop, your dog must remain quietly by your side for 5 seconds. Although your dog may sit when you come to a stop, it does not have to. ATD does not require dogs to sit during the testing process. Remember to encourage and talk to your dog. You may use a firm but quiet verbal correction or a light leash correction if needed. Let your dog know when it is doing a good job too. Nice attention to the handler. And she's talking to him nicely, keeping him with her. Very nice. Reaction to a person moving unsteadily. You may be asked to walk near a person using crutches or a walker, or someone who simply walks unsteadily. The purpose of this exercise is to determine if the dog can handle unusual equipment or someone moving unpredictably. If you have a small dog, this exercise takes place while you are holding your dog in your arms, in addition to while it is walking beside you on a leash. Canine to canine. The purpose of this exercise is to ensure your dog isn't dog aggressive. Although your dog will not directly interact with other dogs, because our rules say dogs must keep a minimum distance of 2 feet between each other, they must be able to behave around other dogs. No staring or barking or sniffing each other is allowed. The tester will have you walk near another handler with the neutral test dog. You might be asked to walk past them, around them, or be circled by them, always no closer than 2 feet. If you have a small dog, this exercise takes place while you are holding your dog in your arms, in addition to while it is walking beside you on a leash. And here comes our young friendly dog. A little interest is okay. He says, oh, she's cute. That was very friendly, and the handler gave a slight correction. Review of handling test results. Once your test is over, the TO will review your results in a private place. Don't be discouraged if you're advised you need to work on certain exercises and retake the test at a later date. Some of our most valued members have failed the test the first time. You'll have 3 opportunities to pass the test. You must wait at least 30 days in between testing, but don't feel you need to rush it. Take your time to work on the exercises you need to improve. The more confidence you have, the more likely you are to succeed. Once you pass the test, you'll attend a series of observations where you and your dog will actually visit with people. The TO will evaluate you as a team and will also give tips and help with positioning and visiting. At least 2 of the observations will take place in a medical facility similar to what you saw in the video of a visit. One of the 3 may be at another location such as a park, library, or airport, or all 3 may be at a medical facility. We wish you the best of luck and hope this video helped you see what's involved in the ATD testing process. If you have any questions, please ask your TO for more guidance. We look forward to welcoming you as a new member.